This is going to depict minimal sedation. Mr. Jones has had 2 milligrams of Versed, and I'm going ahead and giving him another 25 micrograms of fentanyl. Things that I'm going to assess with Mr. Jones as I'm providing sedation. The most important thing is that someone continues to breathe and they have a patent airway. So I'm looking at Mr. Jones's chest rise and fall. I'm looking at his skin color to make sure his skin color is adequate and still pink, suggestive of adequate oxygenation. I'm also going to look at the mask to make sure that there is fogging of the mask when he exhales, again suggestive of a patent airway. In addition, when we look at levels of sedation, we're going to look at the central nervous system depressant effect, their level of consciousness. Mr. Jones, how are you doing?
I'm fine.
So Mr. Jones responds with a minimal prompt. In addition, I'm going to be looking at our technology, our monitors. We have a blood pressure and an EKG. We always have our oxygen saturation, and that suggests the amount of oxygen in the patient's blood. We're going to be monitoring end-tidal CO2. It not only gives us a waveform and allows us to see if the patient is obstructing, also gives us a value, and then lastly, his respiratory rate.